A bit of introduction. My name is Dr. Rana Taji. I am the owner and medical director of Toronto Medical Eye Associates in North York. I own a pretty large dry eye specialty clinic here, in addition to a lot of ocular disease. So we do a lot of glaucoma, diabetic retinopathy management, macular degeneration, eye emergencies, and so forth. So today's talk, I'm really honored and humbled to be here because I think that this is a big topic and it's very near and dear to a lot of people's hearts. Everybody knows somebody that's touched by dry eyes or is experiencing it themselves. So I'm very thankful to have you guys have me here. So basically, what I want to do today is I want to talk about dry eyes from a very personal level. I don't want us to be very overwhelmed by the slides. I'm not going to go over all of them. They're very overwhelming, but I want everybody to kind of understand what dry eyes encompasses from a practitioner standpoint. So when you look over the slides later, or if you've already perused through them, you'll see that there's a lot of information about the different diagnostic technology that we use, the different treatment plans that we use, how we talk to patients about dry eyes, and why it's important for us to really focus on, let's say, doing a dry eye assessment as opposed to just getting our eyes checked routinely, which kind of looks at a comprehensive look of the health of the eyes. So we'll just look at, a little bit about the importance of dry eyes, why it's on the rise, what does really dry eye mean, what does it look like for a patient, and when this needs to be investigated further. And I'll talk about very briefly the diagnostics and treatments that we have, and then just understand the functional component of it and how much it can really affect our eyes if it gets out of control. And then just give you some strategies on prevention and to be able to slow this down. So why is this so important? In the US alone, back in 2017, they estimated that the number of people that had dry eyes was about 14.5%. And at this time, 16 million people in the US were diagnosed, and that number is projected to increase. In Canada, we still don't have any new and recent data with respect to how many people. Back in 1997, it was over 28% of people had been diagnosed. So on a global impact, when they did a study in 2021, they showed that the estimate was basically close to 11 million people. And then when they were doing, surveys during the pandemic, they were showing that a lot of people had increased dry eye symptoms as a result, excessive screen time use. And so of those patients that they surveyed, they were showing that over 59% of people were struggling and wanted relief as a result of their dry eye symptoms. So what are some of the big risk factors is our high exposure to electronic devices, our changing lifestyle and environmental factors, and then even increased medication use, I would say, are the top three factors. So when we look at this disease, the dry eye workshop defines it as multifactorial, right? So basically there's multiple things that are contributing. It causes, a reduction in arterial volume. These tears that are on the surface of our eyes, they break up more rapidly, and then it causes them to evaporate quicker. And then that is what causes that instability of the tear film, and essentially what leads us to the dry eye symptoms. So what does the patient look like? What do we feel when we're experiencing dry eye? One of the biggest symptoms sometimes that people will say is that my vision is blurry, but it's not constantly blurry. So it fluctuates in blurriness, and that's a telltale sign of dryness. If they're experiencing a lot of light sensitivity, if their eyes are excessively tearing. So sometimes, we will think that, oh, my eyes are not dry because they're always watering. Watery eyes is actually a sign of dryness because your tear flow system is overcompensating by producing excess tears, but they're not the right tears. So that's a symptom of dry eyes. If you feel like you've got something in your eyes, if the eyes are burning, if you feel like there's pressure and or pain around the eyes. And so there's a lot of risk factors that we need to consider. Our age is one of them. If we've got, a specific hereditary factor, if we have any medical conditions, any autoimmune conditions, environmental conditions, let's say if we're in a specific, dusty environment, even if like there's a house, for instance, that has a higher percentage or incidence of mold, that needs to be something that needs to be addressed as well. Occupational environment. So a lot of us are on screens for our careers and our occupations, and ultimately there's very little that we can do about that, but that is something to be aware of, that it is definitely contributing to our dry eye symptoms. if we're diabetics, if we've had previous eye surgeries, if an individual is a contact lens wearer. So as a patient, it's important to understand what are these things that are contributing to my dry eye symptoms. The most common ones, number one, I will say there's been an explosion in dry eye symptoms as a result of an increase in electronic device use. Certain medications are going to exacerbate your dry eyes. If an individual has a lot of, let's say, hormonal imbalances, previous eye surgeries, and of course, lifestyle and dietary factors. So I'll go over the tear film and I'll just gloss over it because you guys can read about that later. But basically, when should we really look at this? We should really look at this when we're doing our comprehensive eye exams just to basically ascertain where the patient is. So usually I'll tell practitioners basically get like an introductory screening form, just look at some introductory questions just to basically see if that patient has it. And then, if they are symptomatic, then that's when you'd want to go in and you'd want to investigate further. So a lot of people are thinking, well, I get my eye exam done every year. I don't need to do anything else. Well, a lot of the time during eye exams, we'll just recommend first line therapies. But patients might not be compliant with those first line therapies. They might not have provided relief. And so then it starts to affect their functionality and it starts to become an issue for them. And that's when just a routine eye exam may not be enough. And that's when we really want to consider further, more comprehensive ocular surface disease assessments. So as a patient, you may not know this, but you may want to further investigate this, right? So is your eye exam addressing all of these things? And chances are not, because usually with our focused dry eye assessments, they are very comprehensive and just tailored and structured to looking at what I like to call the dry eye beast. So this is where I say we want to consider an ocular surface disease assessment. And that's a problem-focused exam. It's looking at that tear film stability. It's addressing the underlying issues of the dry eye disease. And then it's allowing the practitioner, your dry eye doctor, to basically develop an algorithm and provide a stepwise approach to take care of your dry eye disease symptoms. Then the other big part of it is the patient education. So we spend a lot of time talking about this because this is not something that can be cured in a night or day. And ultimately, there is no cure, but it's a condition that needs to be managed. And so there really is a journey. So I say, find a doctor that is specializing in dry eye disease, that is doing these comprehensive assessments, because it's just not, it's a disservice to be able to do that within a routine exam. And this is just a little bit more of a comprehensive definition about what that assessment entails. So again, just going through, so in a ocular surface disease assessment, this is just kind of like a little rundown of the different testing that we do. So as you can see, this is testing that would not necessarily be done during a routine exam. And so that's why your ocular surface disease assessment is going to be tailored specifically to the dry eye. And then looking from an evidence-based standpoint, we've taken our DEWS workshop for the Tear Film and Ocular Surface Disease Society, and we've based our diagnostic algorithm based on that diagnostic protocol. So when we do diagnostics, we like to really look manually at what the meibomian glands look like. We like to measure salt content of the tears, because that can damage nerves, it can drive inflammation, it can destroy the corneal epithelial cells, and that basically means that the salt content is out of whack, so to speak, in the eyes. Another part is inflammation. So dry eye disease definitely drives a lot of inflammation in the eyes. So it's important to know if those inflammatory markers are positive or negative. And just, this test will show you how to quickly, how to quickly do that. And then meibography. So I want you guys to think of meibography like x-rays for the teeth, right? So very important for us to do meibography. It's infrared imaging of the glands because it's going to give us a lot of information about the structure of these glands. And so I always say meibography to the dry eye specialist is like an x-ray to the dentist. It's very, very crucial and important. And this, like I said, is visualization of the glands. And so it's going to give us a lot of information about the structure. And this is just a grading scale to give you an idea of how we grade and assess the meibomian glands. Then we'll go over to our treatments. So microblepharoexfoliation is a procedure that we use in the office to basically cleanse the lids and the lashes of any debris that can be as a result of bacteria or even something called Demodex mites. So a lot of people may not know this, but it's similar to how you have lice in your hair, you may have lice along your lid and lash margin, and that can exacerbate dry eye symptoms, and it can also lead to a lot of inflammation within the eyes and cause further issues. So this in-office procedure, one of my first patients that I ever did this on in 2014 said, this is like a car wash for my eyes. So it's a very nice thorough cleansing. I compare it to a dental cleaning where I tell patients that, we really do a great job at lowering that bacterial count, but it does reload. So this is a chronic issue. So like a dental cleaning, we recommend it depending on how much bacteria reloads every 6 to 8 months for patients. Then other procedures are thermal heating, and that's where we take care of the glands. So if you are on a lot of electronic devices, thermal heating procedures might be appropriate for you. And that's where we're going to basically take the melting point of the glands, and we're going to liquefy what's hardened in the glands, and then evacuate them afterwards, so that that provides you with more stability to the tear film. Next thing is IPL. So that's a procedure which is like, it's not a laser, but it's got laser-like properties. So it's actually an intense pulse light, and it helps to liquefy the hardened oils, but also reduce inflammation. And then I'll quickly talk about intraductal probing, which is a little bit more advanced. So we talked about the blepharitis. So this is what a dirty eye looks like, right? So if you guys look, you can see so many crusts and collarettes and scurf along the lash margin. And we diagnose this essentially through this slit lamp. And, like I said, this can cause inflammation, can lead to discomfort and irritation and burning. And so different protocols within the office we can do to clean. When we're doing gland treatments, we want to address any obstructions within the glands, and we want to clear those. So we've got in-office therapies to do so, and then we also send the patient with homework, right? So at home, if you are on electronic devices frequently, heat therapy is going to be very instrumental, and I'm going to want you to look at heat therapy the same way that you would think about flossing for your teeth. So other procedures of thermal heating, the radio frequency in the office. This used to be a procedure that's still used in the aesthetic space to basically kind of take care of fine wrinkles and lines. So it's been used in the aesthetics industry for over 10, 12 years. And then they stumbled upon it that it was actually helping with dry eye symptoms. Intense pulse light, been used again in the dermatology space before they stumbled upon this finding that actually it was reducing the inflammation around the eyes. It's associated with a condition called ocular rosacea. There was basically a lot of buildup of superficial blood vessels that were exacerbating the dry eye symptoms. So these are things that we look at, and we determine which procedure is appropriate for the patient to basically maximize relief. And then the last procedure that I'll talk about is just intraductal probing. So essentially, this is a little bit more advanced, because basically what we're doing is, if we look at the lid margin, there's 25 to 30 glands on the bottom, on the top of each lid. And what intraductal probing does is we basically go through every single gland to clear the obstruction through it. So typical blockages within the glands are the secretions becoming hardened, changing in consistency. But probing basically tackles another obstructive nature, which is scar tissue that forms within the gland, that can lead to more inflammation. And so this is a more advanced procedure. Typically, we don't start with this first line, but based on clinical trials and previous research, 67% of meibomian gland dysfunction has been thought to actually be obstructive. So a lot of the times, our patients will come and they'll have tried multiple treatment modalities. And once we look and we assess, we find that, actually there's been a lot of obstruction, and we need to ultimately start with this. So I like to also, talk to patients about foundational dry eye therapy, which is what it is that you're doing at home, how it is that you're taking care of your body. So omega-3 fatty acids are very instrumental. Now, if we think about our North American diet, we're actually like 10 to 1, upwards of 25 to 1 of a ratio of omega-6 to omega-3. So omega-6 is like the not so good fat, and the omega-3 is the good fat. And essentially our normal ratio is supposed to be 1 to 1, but here in North America, that's skewed because of like so much inflammatory foods, so much processed foods. So that's why our dry eye disease sufferers really need to be on a good, high quality omega-3, which kind of helps to skew that ratio back and helps to liquefy the hardened oils within the glands. So I'm just going to take a quick look to make sure that I'm going really good on time, because I want to give you guys as well time to ask any questions. Then the other part is autologous serum drops and platelet-rich plasma drops. These are also treatments that are available to patients because they basically use the patient's own blood, we coagulate it and we centrifuge it, and essentially we create drops out of the blood that we take from the patient. And what that does is there's a mechanism of action there that's postulated that there's growth factors within the blood that essentially will help to improve the dryness symptoms. And this is great too for patients that have like a lot of corneal issues. And so this is one treatment that we've added into our dry eye regimen to help with patients that suffer from severe dry eye symptoms. So a big thing in the dry eye space is how do we improve our communication in order to explain this to the patient and so that they can understand that this is a journey. It also often involves like a partnership, active two-way communication between the patient and the practitioner. So I always tell people that it's very important for the patient and the practitioner to be very open about expectations, right? So I want to ascertain what the patient's motivation is like. So sometimes, these procedures, these treatments can be cost prohibitive. So it's important to understand where the patient is in terms of their financial capabilities to be able to do these. And then I want to understand, where they are in their dry eye journey. So I want to understand basically if they've come to me and they've already seen one, two, or three other practitioners and they've tried everything under the sun, or if they're green and they haven't tried anything. So oftentimes, if somebody is suffering but they haven't done anything yet, usually I'll start with in-home therapy. And there was a question in the chat about, well, what can we do at home? So the first thing would be to consider heat therapy if you are on electronic devices all day. So the reason that you want to do that is because you want to essentially try to melt away the secretions that are plugged up in the glands. And so your easiest way to do that is going to be with a heat mask. And there's different types of there's different types of heat masks out there. There's microwavable ones, there's disposable single-use ones, and then there's electric masks as well. So we've got different options because not everybody has microwaves these days. A lot of individuals are now more concerned with EMF radiation and whatnot exposure. So they've shied away from having microwaves in their house. So we do have options in terms of like if you're traveling, the disposable ones, or an electric mask as well. There was another question, are any parts of the consultation or treatments covered via OHIM? Unfortunately, as of now, there isn't. A few weeks ago, I had a call with the ministry, about the importance of covering these. So it's in their hands, but we've definitely had discussions surrounding the importance of this because there is an economical impact because of how much functionally debilitating this can be if it gets to advance. So, I've had patients that have had to like take leaves of absences off of work. They often find themselves, taking time off, calling in sick more than not. They feel that they're not productive at their jobs. They're not able to partake in activities with their children, with their families, and so this is something that is very, detrimental to our society if we don't take care of it. So it was something that I made sure that the ministry was aware of because as of now, we haven't even begun to quantify the economic impact of how much this is really affecting our workforce. All right, so let's go up to, so what are other daily options outside of heat therapy if I react to ZocuShield? So ZocuShield is a lid cleanser, right? And it's great, but it's only one type of lid cleanser out of 3 or 4. So there's a lot more, I would say, gentle approaches. So ZocuShield is an ochre-based one. You have BioSil, which is basically diluted hypochlorous acid. So I would consider that. You've also got Blefadex, which is a combination of tea tree oil and coconut oil, which I find to be a little bit calmer. But ZocuShield, I would say, is pretty strong, and it's not meant to be used permanently, right? So you're only supposed to use the vial until it's done. But there should have been other, I would say, modalities that should have been offered, and it really all depends on what is the underlying issue that caused your practitioner to recommend ZocuShield, right? So typically ZocuShield is more for like Demodex or mites and it's not for blepharitis. So if they were convinced that that's what it was, that it was the Demodex and you reacted to ZocuShield, I would consider looking at Blefadex wipes. Are there any special considerations to keep in mind with heat therapy if you suffer from ocular rosacea? Absolutely. So if you do suffer from ocular rosacea and you're doing heat therapy and it's basically inflaming you even further, then we typically will say don't do the heat therapy until we get that inflammation under control. And once it's under control, then you can do heat therapy on an interim basis. So I don't recommend heat therapy for my ocular rosacea patients on like a regular basis, because if the heat is exacerbating your symptoms, then there's something else that's causing that. So the inflammation, obstructions and blockages within the glands, and that's something that also needs to be considered. And the dry eye practitioner should be able to guide you on that as well. Thank you for advocating for the government. Yes, absolutely. This is very important. Are there over-the-counter drops that you recommend? So important with over-the-counter drops is that when you go into the pharmacy, you're going to see a ton out there. I particularly don't like to recommend any over-the-counter drops, just because I like to minimize the amount of preservative that's going into the eye. So unless you're sure that there, and it says preservative free. The other thing is that I like to reduce the amount of chemicals that are being exposed to the eye. What that means is that a lot of these ingredients that you see on the counters are going to be full of synthetic alcohols and whatnot. So even like your sustains and your refreshes. So the ingredients that I recommend usually are going to be free from that. They're going to be free from parabens. They're going to be free from alcohols and synthetic ingredients. So my main go-to drop actually is Thealo's Duo, and it's got a plant-based ingredient in it. It's got sodium hyaluronate, so you've got two drops within one in there that really help to kind of, I would say, not just heal the cornea, but prevent it from, further damage. What was the name of the tea tree one? So it's called Blefadex, and it comes in a foam and it comes in wipes. What are the optimal settings on your screen settings to minimize irritation? Honestly, I think the biggest thing is improving contrast, and you can put a blue light blocker on your screen, but I will caution you, there's not strong evidence that blue light has anything to do particularly with reducing eye strain. I think it's more about when you're on your electronic devices for a prolonged period of time, the biggest things that you want to do is you want to take frequent breaks. So every 20 minutes, you want to look away at a distance of 20 feet for 20 seconds. You want to make sure that you're forcefully blinking, right? So it's the mechanical action of that blink that what helps to push out the secretions within the glands. And when we're on the electronic devices, we are blinking at a fraction of the rate that we're supposed to. In fact, it's like a tenth of the rate. And so that essentially is what's causing these glands to get plugged up as a result of the electronic device use. Is there a relationship between dry eyes and glaucoma? There is a relationship between dry eyes and glaucoma, because if you are a glaucoma patient who is taking glaucoma drops, almost all of these glaucoma drops have preservatives in them. And these preservatives, essentially, they're changing the composition of the white part of the eye, the cells. They're exacerbating and inducing dry eye symptoms. So yes, 100%. We have so many lectures on the relationship between ocular surface disease and glaucoma, because essentially you're trying to fix one thing, but you end up creating another problem. It's a very, very huge topic. So what are some day-to-day strategies? So we talked about when you're on the screens, trying to blink as much as you can, trying to forcefully be aware of it, take breaks every 20 minutes, look away. The other thing is that when you're done with your workday, be done with screens. And what that means is that don't go home and start streaming on your phone, start streaming on an iPad. Like, alternate with outdoor activities, alternate with activities that are going to use your vision for distance and minimize your screen time. So, like I said, a lot of the times there's nothing that we can do about, our jobs because they're on the computer. But what you need to do is you need to mitigate your screen time. So actively looking to minimize your screen time is going to be your best defense against slowing this down. And then the other things in terms of preventing are just using your heat mask on a regular basis. So heat mask and omega-3s, those are foundational in terms of dry eyes for preventative and maintenance. Can the recommended type of eye drops be written on the chat, please? Absolutely. So I'll write it down. It's called Thealo's Duo. And we actually have them on our website. I'm not trying to put a plug for our website, but you can definitely put them, you can definitely order it through our website. So Kaylin said Blefadex, yeah. So those are the wipes. They come in wipes and they come in a foam. Can you put the name of the plant-based? Yep, so I did that. So I think I've gone through, oh, there's one more question. I have an electronic heating pad for my eyes, which has the option to turn heat low, medium, or high. Are there any benefits to the degree of heat? So basically what happens is normal meibomian gland melting point is actually 32 degrees. So it's very low if your glands are olive oil like transparency. If you're someone whose gland secretions are more thick and more cloudy and more toothpaste like, then the melting point for those glands is going to be higher. It's going to be actually 42 degrees. So I would say that the benefit to using higher heat is going to outweigh, because what you need is you need to be able to melt the secretions within the glands to liquefy them to help express what's inside of them so that you can further stabilize the tear film. Is there a preferred duration? Typically 7 to 10 minutes is what I recommend. I have uniform heat. Any recommended electric masks? Yes. So it's called the Wizards. It can be found on Amazon. So that one came from the US and they had actually done clinical trials to study. And I believe on the high heat, it was reaching a temperature of 42 degrees. Okay, let me see where I am. So we talked a little bit about, the communication standpoint. I talked a little bit about the functional component of dry eyes. So, this is why I tell people, it's important to take this disease seriously because of the significant impact. A lot of people, when they get very advanced, they can't perform their jobs, and then, like I said, over 90% of our society does do our occupations on electronic devices, and even finding recreational activities becomes uncomfortable, and then our mental health becomes affected, right? So, and there is a scientific link between mental health and dry eye disease. So the more our dry eye symptoms get exacerbated, if we have anxiety and depression issues, then that basically is a feedback loop, from our central nervous system to the inflammatory component with our dry eyes, and then our dry eye symptoms actually exacerbate as a result of more inflammatory mediators that get released from, the central nervous system. Okay, so, we talked about, preventative strategies. So practicing good, I like to call it eye hygiene. The foundation for me is the heat therapy and the supplementation. So getting a good heat mask and then getting a good supplement of omega-3 fatty acids. Actively work on reducing your screen time. And then as well from a lifestyle standpoint and dietary standpoint, engaging in healthy eating habits, right? So limiting your processed foods, limiting your refined sugars. So there was a study done out of Duke years ago. They basically looked at the meibomian glands of a 10-year-old who basically just ate a diet of fast food, of McDonald's. And they found that over 50% of his glands were dead at 10 years old. Because what happens is with these processed foods and the refined sugars is it's a lot of thick omega-6 consistency of the glands instead of the omega-3, and that can have a very detrimental effect on the structure and function of the glands. Okay, so, and there's a couple of case studies in there, so you guys can go through them if you'd like. Just basically patients that, went through the comprehensive ocular surface disease assessment. So a lot of basically very technical notes in there. We talked about what their treatment plan is. And so basically, if you look at this first patient, when they entered in, they had an entry-level DXQ score of 14, which is pretty high. And then, once we finished with all of her treatments, we did radio frequency, we prescribed her an anti-inflammatory. Her dry eye score improved significantly, went down to 9 from 14. Her inflammatory markers improved as well. So at this point, we track progress, we continue with in-home therapy, and she's on a maintenance session of radio frequency every 6 to 12 months, depending on her symptomatic profile. And then same thing with this patient, started off with a very high score of 16. So I tell people a DEQ score over 6 means that you're symptomatic, right? So with this patient, we booked combination procedures of radio frequency and IPL, and then her score improved from 16 to 6. So she's basically mostly at bay right now, and she gets treatment maintenance sessions once a year. So when people ask me, how often do we have to do this? So when we do our round of sessions, first, like let's say 4 sessions typically at the beginning, and symptoms have improved, then typically what happens is you get put on a maintenance schedule. And your maintenance schedule looks like once a year. If your symptoms are more advanced, we may recommend once every 6 months. All right, so Wizard out of stock. All temperature degrees are in Fahrenheit, 42.5 degrees Celsius, not Fahrenheit. Wizard is out of stock. Let me see. I don't think the Wizard is out of stock. It's on Amazon.ca. I hope you looked. My website, yeah, Toronto Medical Eye Associates.ca. So I think for the Wizard, I'm gonna write my clinic's email address here. If you go to it and just send us an email, we'll send you the link to the Amazon one that has the Wizard. So it definitely should be in stock. Does anybody have any other questions? I'm on Instagram, so if you like to follow along for any interesting cases or anything eye related, and as always, I put our clinic's email in the chat. So if you ever have any questions, or if dry eyes is something that's really bothering you, then please feel free to reach out.